It's March 8th and International Women's Day in Women's History Month. So today I'm going to highlight someone who achieved so much awesomeness in a time where it was almost impossible. She absolutely smashed gender and racial barriers and led to huge advancements in the field of oncology. In an era when Black women in medicine were virtually unheard of, she not only smashed the door down and entered the field, but she also changed it forever. Dr. Wright was born in 1919, and she's kind of a legacy doctor. Her mom was a teacher, but her dad was a doctor. In fact, he was one of the very first African Americans to graduate from the Harvard Medical School, and his dad was one of the first African Americans to graduate from Yale Medical School. And so she kind of had it set up from the get-go that she was going to be a doctor. However, when she went to college, she decided that she wanted to get an art degree. She went to Smith College and graduated in 1942. But after she was done there, she knew that it was time to pursue medicine. She was awarded a scholarship to attend New York Medical College and graduated as part of an accelerated 3-year program at the top of her class. She graduated in 1945 with highest honors. After med school, she completed 2 residencies, one at Bellevue Hospital and one at Harlem Hospital, where she was chief resident. Then, in 1949, she joined her father in research at the Harlem Hospital Cancer Research Center, which he had founded, and when he passed away in 1952, she took his place as a director. At the Cancer Research Center, her goal was to make chemotherapy more accessible for everyone. Back then, chemotherapy was pretty much seen as just a last resort, and it wasn't super well defined, so it really wasn't an exact sort of science. It was more like a, hopefully this works because nothing else has. Her research was absolutely groundbreaking. Her group was the first to report the use of nitrogen mustard agents and folic acid antagonists to treat cancer. The folic acid was probably the most groundbreaking thing because it made it so that cells were unable to make new strands of DNA or produce proteins. And since cancer cells metastasize by splitting, stopping the ability for them to do that was a huge advancement in the field of cancer research. Her research is still foundational when treating various tumors and several different types of cancer, including leukemia, Hodgkin's disease, lymphocarcinoma, melanoma, breast cancer, and prostate cancer. And it's pretty much the basis for all chemotherapy treatments today. In addition to that, she also pioneered combining work in different chemotherapeutics, not just thinking about administering different drugs, but also the way, the order, and the dosage amounts in order to increase the effectiveness and also to minimize side effects of chemotherapy. She also developed a non-surgical method using catheters to deliver drugs to tumors in the body, like in the liver or spleen, so you didn't have to go under surgery to receive your chemotherapy treatment. In addition to her research, she was also very professionally active, and in 1964, she was one of the 7 physicians and the only woman to help find the American Society of Clinical Oncology, and she was the very first woman elected president of the New York Cancer Society. Dr. Wright had become a professor and the director of cancer research at New York University in 1955, but in 1967, she was appointed as associate dean and head of the cancer chemotherapy department at the medical college. This made her the highest-ranked African-American physician at a prominent medical college at the time, and most certainly, without a doubt, the highest-ranked African-American woman physician. On top of all that, she was also internationally active, and she was an oncologist who went abroad to spread her technology and to collaborate with folks from all around the world trying to stop cancer. She traveled to China and the Soviet Union, to several different countries across Africa and Eastern Europe. She treated cancer patients as she went, helping spread her methods throughout the world. Jane Cooke Wright wasn't just a scientist, she was a revolutionary. She took on the medical establishment, pushed boundaries, and opened doors for future generations. She was an advocate for diversity in medicine, and she actively worked to increase opportunities for women and minorities in science and medicine, and she collaborated with several other women in the field, holding open the door for women to come. Her work made chemotherapy a viable, life-saving treatment, and continues to offer hope to millions of cancer patients and will for years to come. Dr. Wright said there's lots of fun in exploring the unknown. There's no greater thrill in having an experiment turn out in such a way that you make a positive contribution. Her life is a testament to positive contributions in the field of medicine and the advancement of women across the world. Dr. Wright's impact on the world is absolutely immeasurable. She passed away in 2013, leaving a legacy of advocacy, of brilliance, and of searching for truth. Because with those things, there are no barriers that cannot be broken.